A new study says that skipping breakfast could be linked to poorer cardiovascular health. According to the research published in the Journal of the American College of Cardiology, skipping breakfast is associated with an increased risk of atherosclerosis. The researchers examined the diets of male and female volunteers who were free from cardiovascular or chronic kidney disease. A computerized questionnaire was used to estimate the usual diet of the participants, and breakfast patterns were based on the percentage of total daily energy intake consumed at breakfast. Three groups were identified. One group with people those consuming less than 5% of their total energy intake in the morning, that is, those skipped breakfast and only had coffee, juice or other non-alcoholic beverages. The second group with people those consuming more than 20% of their total energy intake in the morning, that is breakfast consumers. And the third group with people those consuming between 5 and 20%, that is low energy breakfast consumers. Of the 4,052 participants, 2.9% skipped breakfast, 69.4% were low energy breakfast consumers, and 27.7% were breakfast consumers. Atherosclerosis was observed more frequently among participants who skipped breakfast and was also higher in participants who consumed low energy breakfast compared with breakfast consumers. Additionally, cardiometabolic risk markers were more prevalent in those who skipped breakfast and low energy breakfast consumers compared with breakfast consumers. Participants who skipped breakfast had the greatest waist circumference, body mass index, blood pressure, blood lipids, and fasting glucose levels. Participants who skipped breakfast were more likely to have an overall unhealthy lifestyle, including poor overall diet, frequent alcohol consumption, and smoking. They were also more likely to be hypertensive and overweight or obese.